For people suffering from schizophrenia, life doesn't have to be a struggle. Effective drug treatments are available to help people maintain social relationships and enjoy normal day-to-day activities. When combined with rehabilitation treatments, up to 75% of schizophrenics who take medication recover substantially from the disease. Drug therapies for schizophrenia focus on alleviating chemical imbalances in the brain. They work by blocking chemical messengers, known as neurotransmitters, thereby dampening abnormal communication between nerve cells. These drugs, known as antipsychotics, fall into two categories: typical antipsychotics and atypical antipsychotics. Typical antipsychotics were first introduced in the 1950s. They are used to drastically reduce symptoms, such as visual and auditory hallucinations, incoherent speech, and aggression. Three of the more common types of typical antipsychotic drugs are chlorpromazine, fluphenazine, and haloperidol. Chlorpromazine and fluphenazine function alike. Both help suppress hallucinations and paranoid delusions by blocking the receptors of the neurotransmitter dopamine. Unusually high levels of dopamine are believed to trigger psychotic hallucinations and delusions. Haloperidol also blocks dopamine receptors. At the same time, it helps suppress hyperactivity, agitation, and disorganized thinking by quickly calming the patient. Although beneficial for some people, typical antipsychotics usually have significant side effects. These include increased heart rate, blurred vision, weight gain, and tremors. During the 1990s, groundbreaking research led to a new category of antipsychotic medications known as atypical antipsychotics. These medications have fewer side effects than typical antipsychotics. They also relieve a broader spectrum of symptoms, such as flat emotions, social withdrawal, and depression. Atypical antipsychotic medications include olanzapine, risperidone, and clozapine. Olanzapine works by regulating the levels of the neurotransmitters dopamine and serotonin. Studies have shown that olanzapine helps patients improve their motor function, memory, and attention span. Side effects include weight gain, elevated triglycerides, and a decreased ability to absorb insulin. Risperidone also regulates serotonin and dopamine levels and helps prevent disorganized thought, uncontrolled hostility, and depression. Side effects include akathisia, or a feeling of restlessness, and unresponsiveness to insulin. Clozapine works by regulating cognitive functions. Clozapine has been shown to increase memory and attention span in schizophrenics. It also has the most dramatic effect on suicidal thoughts, reducing suicidal tendencies by up to 85%. There are, however, potentially serious side effects associated with clozapine, such as the risk of fatal seizures. Patients prescribed clozapine should discuss the risks with their doctor. Some patients do not respond well to antipsychotic medications alone. In those cases, a doctor may recommend a mood stabilizer such as lithium, antidepressants, or electroshock therapy. Most antipsychotic drug treatments are available in daily and weekly tablet form or as long-lasting injectables. Injectables are recommended for patients who have difficulty sticking to a daily schedule. Patients who are cared for by others may require close monitoring to ensure their medication is being taken responsibly. It's also important not to abuse alcohol or drugs when taking prescribed medication, as this can cause dangerous side effects. Before beginning any drug treatment plan, patients with schizophrenia should discuss the risks and benefits with their doctor. And when a person can't make a sound decision on his own, a family member or close friend should be involved. Making the right choices will give a patient the best chance of leading a healthy and productive life.